Good morning. Thank you for joining this channel. This is Consumers Dr. Bengala. Today's topic, surprise medical billing. Well, it's a big chapter, folks, but I'm going to make into several sections, so you will see several videos on the surprise medical billing. It's a contentious issue among political circles. I understand that, and there have been debates going on how to stop this surprise medical billing. I have no idea why it becomes a big deal among political circles, but it's very easy to resolve the issue. Yes, follow the market-based principle like anything else. Consumers demand and how often. Anytime consumers demand is high, you pick an apple, there's so much, or eggs, any item, any food item, there's a lot of demand. So price is based on the demand and how often that so-called procedures or visits, hospitalizations, that's how you determine how much you have to pay for it. Right now, the way I see it, folks, it's a joke. The way the medical system, billing system is working, it's costing us about 20% of the healthcare cost. I'm not kidding. There are billing companies out there, they're making lots of profits, and you're paying for it. We are all paying for it, yes. Do we really need these billing companies? And this, all these codes they came up with, the CPT code, DRG code, ICD-10. I don't know who made those numbers. How did they come up with figures? This is what puzzles me the most. Don't take me wrong, I've done well with this so-called billing system, but the time has come because healthcare cost keeps rising and the technology is advancing to the level where consumers need to be empowered, and it has to be market-based. Healthcare has to be market-based, folks. There's no other way out. If you're trying to socialize medicine or Medicare for all, whatever you may want to call it, free healthcare, it's not practical. Somebody has to pay for it. Look at Medicare, what a mess. Cost keeps going up. And we don't have any funds left for people, future retirees. There are no funds left unless we clamp down on billing. So the billing system needs to go away completely. And how do you pay for it? I'll give you a scenario. There is a solution out there. But first of all, this medical billing system is costing us a nominal leg. It's costing our healthcare system. We need to ban them. There's no doubt about it. How do you fix the rates? Okay, if there's a consumer demand for hospitalization, emergency care visits, or you name it, folks, you quote a price. Or if there's certain procedures, common procedures, there's a consumer, like a cataracts, there's a demand for cataracts. Provider prices are based on the consumer demand. If somebody is charging more, there has to be more competition among the providers. They have to compete. That's how you lower the price, and consumer or patient gets the best care. They will get the best care. Patient decides the best care, whom they want to go, where they want to go, which doctor to see. They let the patient or consumer decide. Because once you have this deductible health insurance policy up to a certain level, you are responsible. Believe me, and you have money put aside into the health savings accounts. When they have funds in the health savings accounts, consumers are very smart. They're very smart. They're not going to pen, you know, they're not going to spend it like everybody. We all have a tendency to save. I believe, I believe if you give a choice to the consumers, consumers will try to save. And the deductible portion of it has to be comfortable enough for all of them. So if the deductible portion is the one where patient or consumers have to pay for it from their pocket, they will watch out and they will not abuse the system. In the back end, providers cannot bill the companies without your knowledge. As long as there's price transparency in front of you and prices are transparent, there has to be some way we can pay for the care as we receive the care. So this billing system is a nightmare that needs to go away completely. And there is nowadays with this credit card payment system software, you name it, folks, blockchains. There's got to be a solution to pay for the care. Blockchain technology is amazing, amazing. It's all based on individual credit profile. So I would encourage the healthcare to manifest itself into a market-based approach to solve a lot of our healthcare issues. I hope you like this video. I'll continue to stress on how to improve our payment system. So this is a part one of the medical billing segment. This is, I would like to hear some comments, folks, and also subscribe, share, and we'll see you in the next episode. Goodbye. Salute.